Okay, so get this. We're diving into the world of ICUs, those high-pressure hospital units where every detail matters. But here's the twist. We're focusing on something you might not expect: body temperature.
Interesting, right?
It's not just about fever or feeling cold, it's about the science of temperature management and how it directly impacts a critically ill patient's recovery. And let me tell you this medical review you sent over, concise, definitive review, temperature management in the ICU. It blew my mind. It's fascinating.
Yeah, it really gets into the nitty-gritty of how our bodies respond to temperature changes, especially when we're at our most vulnerable. Turns out even small fluctuations can impact inflammation, energy use, even brain recovery after a major event.
It's like the ICU is this high-stakes balancing act for your body, and temperature is one of those crucial factors that can tip the scales in either direction.
Exactly. And for a long time, the focus was all about fighting fever. Like it was the ultimate enemy.
Right. We've always been told to lower a fever as quickly as possible.
Yeah, but this review dives into how fever, while potentially dangerous, is also a natural defense mechanism our body uses to fight off infection. It's a double-edged sword.
So how do doctors in the ICU find that balance between letting fever do its job and intervening when it becomes harmful? That's a tough call.
It definitely is. It's about interpreting what that temperature reading actually means for each patient. This isn't just about looking at a number on a thermometer. It's about understanding the context and the individual.
So it's not as simple as high temperature equals bad.
Not at all. It's far more nuanced than that. And that's what makes this topic both challenging and incredibly fascinating.
Okay, so let's jump into specific examples where temperature management becomes absolutely critical, starting with the situation where every second counts cardiac arrest.
When someone's heart stops, every moment is critical, especially for the brain. It's incredibly vulnerable to oxygen deprivation.
Which is where we saw the rise of therapeutic hypothermia, right? Intentionally cooling the body to protect the brain after cardiac arrest. It was groundbreaking stuff, almost seemed like a miracle treatment at the time.
It did, and there was a lot of initial excitement around it. Early studies suggested that even cooling the body by a few degrees could lead to better neurological outcomes for some patients.
But like with many things in medicine, further research revealed a more complex picture.
Exactly. Larger trials like TTM Hyperion and TTM2 started showing that while preventing fever after cardiac arrest is crucial, finding that perfect temperature target is still a bit of a mystery. What works for one patient might not work for another.
So it's not a one-size-fits-all approach.
Not in the slightest. It's about understanding the nuances of each case. But what everyone agrees on is that temperature management after cardiac arrest is essential, even if the exact protocols are still being refined.
Okay, so we've talked about cardiac arrest, but what about other situations where the brain is at risk? The article also dives into stroke and traumatic brain injury.
Right, so we're talking about situations where the brain is already incredibly vulnerable. And one thing that's consistent across all these conditions is that fever seems to worsen neurological outcomes.
It's like adding fuel to the fire when the brain is already dealing with a crisis.
Precisely. And the review talks about how fever can worsen brain swelling, increased metabolic demands. It's like the brain is saying, hey, I'm trying to heal here. Give me a break.
But here's where things get really interesting. Because you'd think that if fever is bad news in these situations, cooling the body down would be the obvious solution.
You'd think so, right?
But the article points out that trials on cooling haven't consistently shown a benefit for stroke or TBI patients. And even using standard anti-fever medications has yielded mixed results. It's like we're missing a piece of the puzzle.
It's true. We know temperature plays a role, but we haven't quite cracked the code on how to best manage it in every case. And that's what makes this area of research so important.
It highlights just how complex the human body is and how much we still have to learn.
Absolutely. And it underscores the need for more targeted research in this area, because if we can figure out how to optimize temperature management, we could significantly improve outcomes for critically ill patients.
Now, that's a goal worth striving for.
Absolutely.
Which brings us to another major challenge in the ICU: sepsis. Now, this one gets even trickier because, as we mentioned earlier, fever is part of the body's natural defense system when it comes to fighting infection.
Right. So in sepsis, you have this added layer of complexity.
So how do you balance that? When is a fever helpful in fighting off the infection, and when does it become harmful?
That is the million-dollar question, isn't it?
It's like in sepsis, fever is both your body's best weapon and potentially its downfall.
Right. It is a tricky situation for sure. You want to support the immune response, but not let things get out of control.
So what do we know about managing fever in sepsis? The article talked about some research in this area.
Well, one thing's for sure. Simply reaching for the anti-fever meds isn't always the answer. There have been some really large trials looking at medications like acetaminophen to control fever and sepsis, hundreds of patients.
Okay. And what did they find? Did it help?
Surprisingly, no, they didn't consistently show a survival benefit, meaning it didn't really make a difference in who survived their ICU stay.
Wow, that is unexpected. So if meds aren't the answer, what about cooling the body down, like we talked about with therapeutic hypothermia?
They've looked into that too. One trial used external cooling to try and keep patients within a very specific temperature range, 36.5 to 37 degrees Celsius.
That's a tiny range. What was the thinking there?
The idea was that by really tightly controlling the fever, they could reduce the stress on the body, give it a better chance to recover.
Makes sense. So did it work?
It's interesting. Initially, there were some promising signs. The cooled group seemed to have a lower risk of death at 14 days, but when they looked at overall survival, how many people were discharged from the ICU or the hospital, there was no difference between the groups.
It's like we're getting close to a solution, but haven't quite grasped it yet. Are there other approaches being explored?
You're right. It's a bit of a head-scratcher, but
Yeah.
each study, even the ones that don't give us a definitive answer, helps us understand this complex relationship between temperature and sepsis. The article also touched on something called spontaneous hypothermia in sepsis.
Spontaneous hypothermia. Okay, that one's new to me. What is that exactly?
Okay. So it's when the body's temperature drops below 36 degrees Celsius. But it's not because of external factors like being cold. It's the body's own response to sepsis, and it can be dangerous.
That seems counterintuitive. If fever is the body's way of revving up to fight infection, why would it suddenly go cold?
That's the million-dollar question, isn't it? It could be a sign that the body's internal thermostat is malfunctioning, or that the immune system is completely overwhelmed and starting to shut down. We don't have a clear answer yet.
So what do you do if a patient with sepsis becomes hypothermic? Did you just try to warm them up?
Right now, most doctors would focus on gently warming the patient back to a normal temperature. The thinking is to get them back to a stable baseline, but even that approach needs more research. It's more of a let's not make it worse strategy while we figure out the best course of action.
So it's like spontaneous hypothermia is this blaring alarm, but we haven't quite figured out what it's trying to tell us.
Exactly, and it just adds another layer of complexity to an already complex condition. But researchers are working hard to unravel this mystery.
The article did mention one trial where they actually tried warming some patients to above a normal temperature. That seems kind of radical.
It does, doesn't it?
Yeah.
But sometimes you need that out-of-the-box thinking to push the boundaries of what we know. And while there was a hint that it might improve survival, the study was very small.
Yeah.
Way too early to draw any firm conclusions. We need much larger trials to confirm those findings.
This whole deep dive has really been eye-opening. It's amazing how much a simple number on a thermometer can tell us.
It really is. Body temperature is so dynamic, especially in critical care. It's not just about whether someone has a fever, but understanding the nuances of their temperature trends, what those trends might mean.
So as we wrap things up, what's the key takeaway for our listeners? What do you want them to remember about temperature management in the ICU? If I had to sum up this whole deep dive in one sentence, it'd be this. When it comes to temperature in the ICU, one size definitely does not fit all.
You got it. And that leads right into what I hope listeners take away from this, which is the importance of personalized care. It's about recognizing that what works for one patient might not work for another.
It's, as you said earlier, it's about interpreting the temperature, not just reacting to it. And that makes me wonder, are we on the cusp of even more personalized temperature management in the future? I mean, imagine using someone's unique temperature trends to guide their treatment.
It's not as far-fetched as it sounds. The review actually touches on this, hinting that future research could unlock more tailored approaches. Instead of broad strokes, we're talking interventions based on a patient's specific condition and their individual response to temperature changes.
So we're talking about moving beyond just looking at a fever and digging deeper into the patterns, how quickly it's rising or falling, maybe even factoring in a patient's genetics. It's like taking what we're learning from personalized medicine in other areas and applying it to temperature.
Precisely. It's about moving away from a one-size-fits-all model and recognizing the incredible complexity of the human body.
Which leads to a pretty mind-blowing question. Could understanding a patient's individual temperature trends hold the key to even better treatments down the road? It's like this deep dive has opened up a whole new world of possibilities.
And that's what makes this field so exciting. There's still so much to learn and discover, and each study brings us closer to unraveling these mysteries.
Well said. It's been a fascinating deep dive into the world of temperature management in the ICU. Thanks for joining us today and for sharing your expertise.
It was my pleasure. Until next time.